Hello, I'm Donna Catamero, a nurse practitioner specializing in multiple myeloma. I'd like it to take a few moments to talk about an important approval in the treatment of relapsed or refractory multiple myeloma, the expanded indication of Carvykti, a CAR T-cell therapy now approved for just after one prior line of therapy. This is a significant shift. Previously reserved for heavily pretreated patients, Carvykti can now be considered much earlier. In clinical trials, it was compared to standard regimens like pomalidomide-based therapy, and the results were remarkable. Carvykti significantly improved progression-free survival and response rates. Effectiveness was measured using stringent criteria, including complete responses, minimal residual disease negativity, and duration of remission. As we begin to see the 5-year follow-up data emerge, the durability of these responses continue to look promising, indicating a potentially transformative treatment option for earlier stage patients. So now let's briefly touch on access. CAR T therapy, including Carvykti, is typically administered at academic or specialized treatment centers due to the complex nature of the procedure. If you're considering CAR T, it's important to speak with your oncologist about whether you're eligible and which centers offer this therapy. So how does Carvykti work? It's a living drug made from your own immune cells. After your cells are collected, there's a waiting period about 4 to 8 weeks while the cells are engineered and manufactured in the lab. Once the cells are ready, patients usually are admitted to the hospital for a short stay, about 1 to 2 weeks, during which time the cells are infused and side effects are closely monitored. The most common side effects include cytokine release syndrome and neurological effects, which are generally temporary and treatable. Importantly, Carvykti is considered a one-and-done therapy, one infusion with the potential for long-lasting results. However, you need a dedicated caregiver for at least the first several weeks post-treatment to help manage daily needs and monitor for side effects. And you will not be able to drive 8 weeks post-infusion. Care doesn't end after the infusion. One of the most effective models of CAR T delivery involves coordinated care between the academic centers and the local community oncology teams. This means you can receive this specialized treatment at a center of excellence and still return to your local provider for ongoing monitoring and supportive care. My take-home message is this: talk to your doctor. With evolving options like Carvykti now approved for earlier use, it's critical to have open conversations about all available treatment options, including whether CAR T therapy might be right for you. More information can be found on the MMRF website or by speaking with a patient navigator at the MMRF.